Hi everyone, my name is Damaris and we are going to go through a next gen question together using bootcamp.com. All right guys, so here is the first question. It says, the nurse in the emergency department is caring for a 57-year-old male client. In these NGN questions, I want you guys to always look at every single tab before moving on to the question. So you start on the left side, gather all your information, start thinking, what could this be? Then you're going to move on to the right side and you're going to determine what the question is asking you. Here it says in the health history that the client came to the emergency department after feeling short of breath and having a cough for the past 2 days. The client reports sleeping on 2 pillows and waking up coughing several times a night. Expresses feeling very fatigued lately and spending most of the day in the bed or chair. Client appears anxious. He has a history of hypertension, hyperlipidemia, chronic stable angina, and diabetes mellitus type 2. Client expresses concern of inability to afford current medications. So after gathering all this information, we have to ask ourselves the question, what is potentially going on with this client? There are things in the NCLEX where they're not going to tell you what the disorder is. That's where the critical thinking aspect comes in. They expect you to already know right away what is happening to this client. Let's point out a few things and let's pull some of the information from this question so that we can determine what is really going on with this client. So it says that they're short of breath, coughing, sleeping on 2 pillows, very fatigued, anxious. The shortness of breath, the coughing, sleeping on 2 pillows, all of these are signs of something respiratory, right? So we know that there's a respiratory situation happening with this client. But the question is, what is it? In order to get a better understanding, we need to open up the other tabs because it's really going to provide more context to be able to create that clinical picture that we are speculating. Neurologically, they're oriented ×3. No issues there. But look at this respiratory. It says crackles throughout all lung fields. That is a clear key sign of what's happening respiratory wise. That crackles means that there is fluid in the lungs. Remember, you're not a mermaid. You can't breathe underwater. Therefore, crackles is an indication of fluid in the lungs. And fluid gets in the lungs from various different places or reasons. We don't know what that reason or what's causing it just yet. However, we know that it got there and it's there. It's present. S1, S2, and look at that S3. S1 and S2s are normal heart tone sounds. We're good with that. But the S3 is an indication that something is going on that shouldn't be happening. In a normal, healthy adult, or an adult that doesn't have cardiovascular issues per se, that S3 should not be present. GI is normal, active in all quadrants, but look at this extremities. Cap refills less than 3 seconds. That's normal. Pulse is 2+. It's pretty strong, but look at that pitting. You always want the pitting to be 0. This client, it's 1+. Let's move on to the vital signs. Now, we said that there's respiratory happening. There's crackles. Crackles can be caused from mucus and or fluid or blood. In order for it to be mucus related, usually there would be an infectious process happening. And one of the indicators of an infectious process, specifically on the NCLEX, is that there always will be a fever present. In this case, the temperature is normal. Pulse is 115. Concerning. Remember I said 3 things can usually cause crackles: blood, fluid, and or mucus. In this case, it's not the mucus because usually that would cause some kind of infection. So it's probably not pneumonia. And drop down to the blood pressure. If it was blood, we would usually see that blood pressure go down if they're hemorrhaging in their lungs, not up. Additionally, we would typically see something like blood coming out of their mouth, right? So they'll have bloody sputum or, there'll be some kind of issues with their pulse, but their pulse is actually strong. So it's not a hemorrhage issue. So the only other thing we could think of is probably a fluid issue, right? Pulse is 115. That's a compensatory mechanism when someone is having a respiratory issue. And then the respiratory rate, which is 25. 25 is pretty elevated. Look at that pulse ox, 89% on room air. So they have no assistive oxygen going on here. It's just them breathing on their own, and that oxygen sat is 89%. It should not drop below 95%. Okay, so let's gather all the information. Short of breath, they're coughing, sleeping on 2 pillows, they can't lay flat. They're very fatigued. They're not active. They have crackles in their lungs, they have edema, and they have a S3 heart tone. Their pulse is tachycardic, their respiratory is tachypnic, and they're hypoxic, and they're hypertensive. If we put it all together, we have to say that these are all signs of respiratory distress, right? They're in respiratory distress. So now let's move on to the right side of the question. And it says select the top 4 that require immediate follow-up. Immediate means that they can decompensate and code and or die if we don't address it right this second. It cannot wait, right? So let's go through all of these and let's rule them out. 1, coughing. Did coughing ever kill anybody? No. 2, edema. Edema is tempting just like coughing, but again, these are more ancillary symptoms from the root cause of the problem. We want to find what's the root cause. So we're not going to select edema either. It's just telling you that there is fluid overload. Crackles. That is a direct indication that the fluid is in the lungs. We like that. We're going to select that. The respiratory rate also correlates directly with what's happening internally in the lungs. Pulse ox is 89 on room air. We never want that below 95. That is concerning. Blood pressure is concerning, but it's not concerning to the point where they can code from it. Let me just remind you, you want to stay on track with where the question is leading. All of the symptoms that the client has been complaining about are respiratory related. That blood pressure does not correlate to the respiratory system. Therefore, we're not going to select it. Shortness of breath. That is a direct correlation of respiratory issues. So we're going to select that one. Inability to afford meds. Always think Maslow hierarchy of needs. Prioritize that physiological before the psychosocial. So them not being able to afford their meds, we can handle that once the client is stable. We're not going to select that. History of chronic stable angina. Nowhere did it say that the client has been complaining of chest pain. This is a history, meaning that they've had this issue going on and it's currently controlled at the moment. It's not bothering them. Therefore, we're not concerned about it. This is a classic ABC question, airway, breathing, circulation question. And we're always going to prioritize airway and breathing before circulation and respiratory symptoms present. Therefore, we're going to prioritize that respiratory status. And because we know this is indication of fluid overload, as evidenced by the crackles, the pitting edema, the shortness of breath, the coughing, and the inability to lie flat, as well as that O2 sat, that pulse, and that respiratory rate, we will say that this client is having respiratory failure. They're decompensating. We need to address this immediately because they can code. So if you identified that, you were correct. I hope this was helpful. Like, subscribe, share.